Hello everyone, I'm Pharmacist Michael, and today I'm going to talk to you about antidepressants. If you're depressed and you go to the doctor, which antidepressant should you ask for? I'm going to give you my recommendations at the end of this video, but first let's talk a little bit about the different antidepressant classes and the drugs that are in them. I'm not going to cover every single antidepressant in this video, but I'm going to cover the most popular ones, at least that I see in practice.
Welcome to Pharmacist Michael's Happy Healthy Living channel, where you will learn how to improve your life, one video at a time.
So we're going to start with the selective serotonin reuptake inhibitors, or SSRIs. And these work by increasing the amount of serotonin available to the neurons. These drugs are fluoxetine or Prozac, sertraline or Zoloft, paroxetine or Paxil, citalopram or Celexa, and escitalopram or Lexapro. Are they all the same? No. There are differences between them. They do work the same, but they have different side effect profiles, they have different half-lives, and they have different drug interactions. So let's start with half-lives. Prozac has a very long half-life. This can be advantageous if you're someone who forgets to take your medication, because if you skip a day, you're probably not even really going to notice it. But it's not so good if you take it for the first time and you have an adverse effect to it, because that adverse effect will last longer because it takes longer for your body to get the drug out of your system. Other differences between these drugs are drug interactions. Some of them have more interactions than others. Paroxetine and fluoxetine have a lot of drug interactions compared to the other three. Now, paroxetine also has worse side effects because it is more highly anticholinergic, which means that it causes more tiredness, it causes dry mouth, it can cause blurry vision, it just kind of makes you feel crappy. So it's probably going to be down my list. It also has some pretty bad sexual side effects, especially for men. All of them have it, but Paxil is really bad. Citalopram can be good and can help for people who have problems with anger. So that's a time where that one may come in handy. Let's talk about the SNRIs, which are serotonin-norepinephrine reuptake inhibitors. The two main drugs in this class are duloxetine or Cymbalta and venlafaxine or Effexor. These drugs increase the amount of serotonin and norepinephrine, which can increase your blood pressure because norepinephrine is one of the drugs that we use to increase blood pressure with patients in shock, sepsis, things like that. So if you have high blood pressure, these might not be the best drugs for you. The advantage of the SNRIs, especially Cymbalta, is it can also be used for pain control, both musculoskeletal pain and neuropathic pain. The tricyclic antidepressants, or TCAs, are another group of drugs that we can use for depression, but we don't use them all that much anymore since the SSRIs are now available to us. These are drugs like amitriptyline and nortriptyline. These drugs are still used at times for things like pain. They can be used for neuropathic pain. They're also used sometimes for migraine prophylaxis. We have even used them for bedwetting at times. So these drugs can be used for other things, but we don't generally use them anymore for depression. Unless somebody's been stabilized on them for years, we probably wouldn't switch them to something else if they were working well. Okay, let's talk about some of the outliers in our antidepressants. There is a drug called bupropion or Wellbutrin that some of you may have heard of. This drug is used for depression, but it's also used to help people stop smoking. This drug stops people from smoking, by decreasing cravings. There's also a drug called Contrave that is a combination of bupropion and naloxone. I've done a video on Contrave in the past, and the link to that video is available down in the description section of this video if you want to take a look at that. Contrave is probably one of the drugs that I would most recommend if you're looking for something to lose weight. You can't use bupropion if you have a seizure disorder. You can't use bupropion if you are prone to alcohol withdrawal. And you can't use bupropion if you have an eating disorder. And the reason for this is because all of those things increase your risk of seizures. And Wellbutrin decreases seizure threshold. So we don't use them in those types of patients. Another drug that's interesting is mirtazapine or Remeron, and this drug is used mostly for depressed patients who have a hard time sleeping and aren't hungry. This drug can increase hunger and it can also help you sleep. So that is another thing to keep in mind. Mirtazapine is a drug that we use a lot for seniors at low doses to help them sleep. Another drug class is the monoamine oxidase inhibitors. These are way down the road. We hardly ever use them unless we've tried everything else. And it's because you need a special diet to actually take these drugs so you don't end up with a hypertensive crisis. There's a whole list of things you can't eat. I don't recommend those. And the last drug I want to talk about is ketamine. Ketamine is a wonderful drug. The difference between ketamine and the other antidepressants is it starts working right away. Every one of these other antidepressants I've talked about in this video take 2 to 4 weeks to even work. But ketamine starts working immediately. It now comes as Spravato in a nasal spray. The problem with this is you have to go to a clinic. They don't dispense it to you to take at home. You have to actually go to a clinic to get your doses. Insurance doesn't like to pay for it because it's expensive, but it can save lives. You can also receive ketamine as an intravenous infusion for both pain as well as depression. I did an interview with a lovely lady who has had her life saved and changed by ketamine infusions, and I have also put a link to that video down in the description section. So I promised you when I got to the end of this video that I would tell you which drugs I would recommend. If I was a regular person with no other comorbidities, I would always want to start with Zoloft. Sertraline would be my number one choice. And the reason for this is because it's an SSRI. It doesn't have as many drug interactions as other drugs, and it's very well tolerated in most cases. If I was someone who was suffering from pain, I would start with Cymbalta. If I was someone who couldn't eat or sleep and I just felt tired all the time, I would probably opt for mirtazapine. And if I just didn't have any energy, as long as I didn't have a seizure disorder, and I may have some cravings, I'd go with Wellbutrin. So it really depends on what your personal circumstances are. If you want my opinion of what you should take, I'd be happy to talk to you about it. You can email me at michael.brown@sunshinentc.com. I'm a board-certified psychiatric pharmacist, so I have a lot of experience with antidepressants, and I'd be happy to either look over your medication regimen or tell you what I would suggest you ask your doctor for. If you want to be more happy and healthy, take a look down in the description section of this video. You'll find a lot of links down there for everything from nutraceuticals to organic tea. I have a lot of different things for you down there. If you know someone who would benefit from this video, please send it to them. If you've enjoyed this video, give it a thumbs up. And please subscribe to my channel for more happy, healthy living information. My name is Pharmacist Michael. Be happy and be healthy.